Several months ago, Eileen featured Dr. Edward Rashid, a LASIK eye specialist. Having worn glasses or contacts for the last 13 years, I immediately got on the phone and he restored my vision. Not over the phone, but he is joining me this morning. Thank you, Dr. Rashid, for being here.
Thank you for inviting me, Christina.
Now, again, like I said, I'd heard through Eileen, we featured you on the show before, and this is something that I'd always wanted to do, but was kind of always afraid. Do you get that quite a bit?
Yes, I think every normal person would be a little bit nervous about having any sort of surgery, especially eye surgery. But I think once they learn about the procedure and understand how we do it and how it changes their lives, the anxiety level drops way down.
Absolutely. Not only that, for myself, the success rate, first of all, was definitely a plus. And also, I knew that you'd worked with the Spurs before, and I said, hey, if the Spurs trust this guy, I got to trust this guy.
Well, not only professional athletes who have had the opportunity to do basketball players and baseball players in professional sports, but most of the patients are regular people. And,
exactly.
And you hear all kinds of stories. Women who want to be able to get up in the middle of the night because they're afraid there'll be a fire and they couldn't get their glasses and get to their children. People who are watching their children in the pool and worried that if they went in, their contacts would come out of their glasses and they couldn't save their lives. So I've heard about every story, and they're all very good. And some people just want to be independent of their glasses.
Absolutely.
And I think that's a good goal also.
Tell us about the development of LASIK eye surgery. There was the blade versus what you're doing now, which is the laser.
Well, yes. LASIK is a two-step procedure. Okay. The first thing that we do is we make a flap of tissue, and we do that flap so that the eye is very comfortable the next day and the patients can see almost immediately. And then we change the curve on the front surface of the eye. And in years past, we made that surgical flap with a blade. And I have some animation we can show,
if we can take
kind of give you an idea. This is the traditional way that the procedure has been done, and still probably 70–80% of the cases in the world are done this way. But a few years ago, a laser was developed, as you can see here, and all these little tiny bubbles that form we can now use a laser and do an all-laser procedure to create this flap. It's much safer. The visions are better. We can create a flap that's 100 times more precise than we can with a blade. So it's been a big advance and has made the procedure a lot easier for me and a lot safer for the patient.
Well, absolutely. Not only that, but for myself, knowing that there was going to be a laser, which I know is a lot more precise versus a blade that was going to be over my eye, it was comforting to me knowing that we were going to do it that way.
Yes, it made my life a lot better too, knowing that the safety had gone way up. But we're actually seeing much better visions with this new procedure, and I think that's a big plus for the patients.
I actually went to go see Dr. Rashid not too long ago for my checkup, and didn't you say I have like almost perfect vision?
A little better than perfect. You're better than 20/20 now. So
a little better than perfect. That's the first time I've ever heard that before.
You are seeing extremely well, and you did very well. You were a very good patient. I know you were a little nervous going in.
Right.
And I don't think you had too much discomfort.
A little discomfort, but that's because my eyes have just been, but it wasn't anything that I couldn't handle.
Most people tell us that what they feel is some pressure during the procedure. This is an amazing operation. I've been doing eye surgery for 30 years now, and this is one of the most incredible operations in all of medicine. Very few operations can a patient come in to the operating room, and there's not even a needle in the operating room site. We use drops for anesthesia. The surgery may take 20 or 30 minutes. The patient tells us they feel a little bit of pressure, and they're already seeing better as they walk out of the office. So I can't think of any other procedure that does all of those things and gives such an incredible change in the patient's life in such a short amount of time.
Absolutely. Like I said before, I mean, really, people said it changed my life, and I was like, how does it change your life? It absolutely changed my life to be able to have this surgery done.
Well, I hear that a lot. It's very gratifying to me to be able to go in, the next day and see these patients and be able to hear how they already have noticed such an improvement in their vision, and then weeks later talk about how they're still pushing their glasses up when the glasses aren't there, and they're still
worrying about their
at the
contacts.
very last thing at night, they're trying to pick out the contacts, or they're getting very close, and they say, wait a minute, I don't need this anymore.
If for nothing more, it gives you an extra 5 minutes to sleep in because you don't have to go put your clean them up, put them in, make sure they're okay. And
it's worth it just for that.
Exactly. That extra 5 minutes, I promise you, is absolutely worth it. We want to give everyone the information for Dr. Rashid. Life is short, so see it clearly. Check out their website, seeitclearly.com, for some valuable information. Consultations, of course, you do. All you have to do is give them a call at 340-5058. Dr. Rashid, I really am indebted to you.
Well, thank you. You got me on your turf today.
That's right. That's right. Thanks so
much
for being
here.
Got me back. We'll be right back. Stay with us.